Good evening to everybody. I am Dr. Sourav Chowdhury. I am working as an assistant professor in the Department of Neurosurgery at AIIMS Kalyani, West Bengal. So I've been given the topic brain tumor and overview. So to first start with the definition of uh, a brain tumor, that is the growth of abnormal cells in the tissues of the brain. We all know about. They can be either benign or malignant. So, needless to mention, World Brain Tumor Day is observed on 8th of June every year. It was started since 2000. It was first observed by German Brain Tumor Association, Deutsche Hirntumorhilfe. And it's a non-profit making organization. It raises public awareness and educates people about brain tumor as we are increasingly getting more and more malignant brain tumors. So, to start off with, by and large, we get these are the four types of cells that we get in the brain, apart from the neuronal cells. So, the previous ideologies were the neurons is to the glial cells, which form the supportive cells of the brain. They are 1:10. So, the glial cells supersedes the neuronal cells by multiple numbers. You understand? So, now the present concepts are the glial cells and the neuronal cells are almost same in proportion. So these are the glial cells that we get in the brain. So the first one is the astrocytes. They are the major number of cells. They form the scaffolding of the around the brain structures. They give a structural support to the neurons. They also form what we call it as the blood-brain barrier. The foot processes of the blood-brain barrier that you can see that are formed by these astrocytes. Then we go to the oligodendrocytes. These are the equivalent of what we call as Schwann cells in the peripheral nervous system. So the central nervous systems, they do not have Schwann cells. They are lined by oligodendrocytes. So furthermore, we have got this microglia. They are the equivalent of what we call as the macrophages in the systemic circulation. They act as scavengers. And then we have ependymal cells who lines the ventricles of the brain, the third ventricle, lateral ventricle, fourth ventricle, and the spinal central canal of the spinal cord. These are lined by these ependymal cells. So majority of the tumors that we get in brain, they are formed from the glial cells. Lesser numbers are formed by the neuronal cells. So to talk about the incidence and the prevalence of brain tumor in US, it accounts for about 24 persons per 1 lakh population. That is 7% per 1 lakh. They have malignant brain tumors and 17% have non-malignant brain tumors. In India, it is 5 to 10 cases per 1 lakh, and around 2 to 3 person per 1 lakh they have malignant brain tumors. So in adult brain tumors, to talk about, the overall most common brain tumors that we get in adults are the metastasis. That is something which is spread from somewhere else. That is from the lung or the breast or maybe the renal cell carcinoma. So overall, most common tumors that we get are not the primary brain tumors. They are tumors from somewhere else. Now, the most common primary malignant brain tumors are from the glial cells, that is called as the gliomas, or the grade 4 ones are called as the glioblastoma multiforme, the most aggressive ones. They account for 45 to 50%, followed by the astrocytoma, the lesser malignant ones, which accounts for 10 to 5%, and then the oligodendroglioma that accounts for 5 to 7%. Overall, if you ask about the primary means from the structures of the brain. Primary brain tumor overall more common are the meningiomas. So most common primary brain tumors are the meningiomas. Most common primary malignant brain tumors are the GBM, that is the glioblastoma multiforme. Most common overall brain tumors are the metastasis. So this might help you in the MCQs. The other major tumors that we see are the pituitary adenomas that accounts for 10 to 15% and followed by schwannomas like vestibular schwannoma, lower cranial nerve schwannoma further. Now, another entity are the pediatric brain tumors that we get to see a lot. They account for 20% of the brain tumor of the population of brain tumors that come to our practice. So in pediatric brain tumors, the differences are generally in adults we get the brain tumors more in the cerebral hemispheres. In pediatric brain tumors, we get more tumors in places like cerebellum, the brainstem, the optic nerves. And these tumors either are the gliomas or they have both glial as well as neuronal kind of picture. So they are called as glioneuronal tumors. A large number of brain tumors in pediatrics following the glioneuronal and gliomas are the embryonal tumors. By embryonal tumors, there is a concept of brain, stem cells of the brain. So those stem cells, when they proliferate and they go into malignant degeneration, malignant differentiation, they form something what we call as the medulloblastomas or the neuroblastomas. The teratomas, the dysgerminomas, choriocarcinomas, they all form these embryonal tumors. So they form a significant percentage of brain tumors in pediatric. And few of them we get as pituitary tumors, craniopharyngiomas. So majority of the brain tumors, as I have already explained, in pediatric ones, they are more infratentorial. The supratentorial ones are the adult ones. So brainstem gliomas are the major share the major chunk, followed by cerebral astrocytomas and medulloblastomas. Below 1 year, the embryonal tumors are more common in infants, followed by the astrocytomas. Then the tumors from the choroid plexus, epidemiomas, and craniopharyngiomas. In posterior fossa, that is the infratentorial ones, we get to see medulloblastomas and cerebral astrocytomas. Slowly, gradually, we'll talk about all these things in later. The tricky thing about pediatric brain tumors are they generally escape till the very last, because in pediatric the skull is kind of an elastic in structure. The fontanelles tend to open up with the growth of the brain tumor, with setting up of hydrocephalus. So they do not generally present with so much of typical picture of a focal neurological deficit or a very severe cognitive deficit. However, we have to look for certain signs like vomiting, like sunsetting sign, like the eye looking downwards, and the arrest of psychomotor development, like the parent coming and telling you that the kid is not that active the way the kid was. Also, at the later stages, the patient presents with macrocrania, that is a large head, obviously poor feeding, failure to thrive, and sometimes seizures also.